Welcome back. The good doctor is in the house. America's favorite doctor, Dr. Oz. He's in town here in the Palm Beach area, and he's here with us to answer some of your questions.
Thank you so much for being here. So we'll just jump right into it. You know, the viewers have so many questions for you.
And I love answering them.
Well, we've got plenty for you. So recently you recommended the shingles vaccine on your show for those over 60. Now, one of our viewers asked, does fibromyalgia create complications with the vaccine, and are there any side effects?
I'm always worried about giving people with fibromyalgia anything. Let's just talk for a second about what fibromyalgia is. It's a short-circuiting of the body's energy system. It can happen from viruses, from trauma, from all kinds of different factors can play a role in messing up the very delicate balance we have in our bodies. Vaccines are traumatic to us. I still think the cost-benefit, the trade-off is worth it for the shingles vaccine because so many folks will get a recurrence of that chickenpox virus in their nerves and cause symptoms that sometimes can last for weeks and months. That's all important to recognize. But if you've got another problem like fibromyalgia, please deal with that first before you start getting the vaccines. I just don't want to complicate your life even further. What do you do about fibromyalgia? Physical activity, critical, and try something called D5 ribose. It's a type of sugar, but it's been really effective for a lot of folks who've called me in the past, come on the show and talked about fibromyalgia. If everybody else get the shingles vaccine, remember, just because you had chickenpox when you were a kid, it doesn't mean it won't come back again. And if you did not remember having it, you probably still had it. You just didn't remember it.
All right. Moving on now to a timely topic. A lot of us have been struggling, especially this week, with allergies. We're in sort of the middle here in Florida, Dr. Oz, of a bad pollen season. Is there any way to stop it? Is there anything natural we can use? Help us out.
Well, I know all about the allergies. My wife's family lives down here. That's why I spend so much time bothering you guys coming to the station. The reality is it's a compilation of factors. You have dry winds right now, carries the pollen a long way. What are you going to do about it? Don't forget that the most common times that you're going to get hurt at the early morning hours. So from 5 to 10 in the morning, be thoughtful and cautious about how much you expose yourself to the outside world. Okay. Moving past that, two really quick tips. They work well. The neti pot is hugely effective. That's that little teapot you pour into your nose and it goes through your sinuses. You know how you brush your teeth? You want to clean your sinuses too. The pollen will set up shop there and it causes a lot of issues. And one natural remedy you may not have heard of, but it is incredibly effective. It's been used in multiple trials. It's called butter burr.
Butter burr.
You know how Harry Potter has butter beer?
Yeah.
Yeah, this is not that. It's butter burr. And you're not going to put it in your nose. It's a pill. It's a capsule. It's about 50 milligrams a day.
You can get it at
over
grocery
the counter,
store.
Yeah,
anywhere.
Grocery stores. They have them in health food stores. Pharmacies have them. Butter burr. Butter and then B-U-R at the end. It's one of those herbal remedies been used for thousands of years as far as we can tell. It's for all known written medical history. They've been talk about antihistamine effects of them like butter burr, but there are no side effects. There's no drowsiness with it. So if you don't like the traditional pharmaceutical pills, you might want to try this as an alternative.
All right.
Well, speaking of those natural remedies, on your show today, you're going to be speaking with Dr. Joe Mercola, a popular but controversial leader in alternative health. Now, you just talked about butter burr. Is that the #1 supplement you think people that have never heard of Dr. Mercola should be taking, or is there another supplement that people that have never heard of this doctor think they should be taking?
Dr. Mercola, just for a moment, we've done a lot of shows about alternative medicine, about complementary medicine. These things are very important to me because I think they provide a globalization of medicine. You know, this media broadcast can be seen anywhere in the world, right? Finance is global. That's why we have problems sometimes. But medicine has stayed very provincial. So I want to open our minds to what can be found if you look beyond the normal, very blinded look of organized medicine. And I'm a real doctor. I practice heart surgery. Today's my surgery day usually. So I know what it's like to be within the ivory tower practicing medicine. But alternative medicine provides us a wonderful opportunity to spread our wings and broaden the vista of healing tools. Joe Mercola is a real inflammatory person. He goes out there right in the face of organized medicine. He says there are things out there you're not paying attention to. And it's controversial, but I wanted to at least allow him to have a voice to educate our viewers. He argues that coenzyme Q10 is the most important supplement you can take. It is a very powerful antioxidant. If your vitamin C or vitamin E levels are low, it's important to build up those stores. And this is a really important tip for everybody. If you're taking a statin drug for elevated cholesterol, you have to be on coenzyme Q10 because statin drugs will deplete your muscles of this chemical and it's needed for the energy packets of the cells to work, the mitochondria. And without that coenzyme Q10, you'll get those muscle cramps that so many folks complain about. So try it out. You need to give it a couple weeks before it'll really work for you.
Should everyone take this coenzyme coenzyme Q10 or just folks with sort of hypertension or heart problems?
No, Joe Mercola would argue everyone should be on
Everyone,
it. Yeah,
okay.
and it's a powerful antioxidant. I put it at my second level. I think everyone ought to be on a multivitamin. They ought to be taking an extra vitamin D capsule, or unless you're going to get some sun, like I talked about earlier in the weather report. And then you need an omega-3 fat, especially if you're worried about your memory. Omega-3 fats are important for your brain and for inflammation. That's my first line. The next line, if you're going to take an extra pill, I agree with Mercola. It ought to be coenzyme Q10.
All right. We always learn so much when you're here, whether you're giving us medical advice or doing the weather.
I love being here.
You are a joy.
And
you
welcome.
are a joy.
Thank you very much. Thank you very much.
And as always, you can catch Dr. Oz weekdays, every weekday, right here on News Channel 5 at 3 p.m. Thanks so much. Good to see you.
Thank you very much.
We'll be right back.